Having a background in physical activities, yes, having a background in dance, loading trucks for many years in a Teamsters union, digging ditches when I was 17 and installing pipes, right? All kind of inform who I am as a physical therapist. And at some point I suffered my own injury. I was in my mid-20s, what's the next step for me? And I spoke to a friend of mine, a family friend, who actually ran the International Center for Disabilities. And I was considering which schools to go to. He said, what a great career change for you. You've done this different work, but I think there may be a time when you want to grow and expand. And the best place to do that from for you would be Columbia. One thing that's wonderful about Columbia is you're right in the middle of this huge urban center. You know, here you are, New York City, it's a neighborhood, it's this huge institution, New York Presbyterian and Columbia University Medical Center and then Columbia University itself, right? And you're exposed to all kinds of things and all kinds of people. And to me, that was exciting. I've had 4 generations of the same family come to me, right? I've had Nobel Prize winners come to me. I've had people who were homeless before they come to see me. Sometimes someone will come in and they have to give an address to the UN and they have a pinched nerve in their neck. We'll treat their neck and the cervical spine and try and help to decompress the nerve or help them manage their pain and symptoms. So I'm the physical therapy director of the Spine Center here. I work for the Department of Neurosurgery. I teach quite a bit. I teach in physical therapy department, which is a pleasure. I get to teach in rehab medicine. We also teach in anesthesia, actually, as part of their pain medicine fellowship. It's interesting because part of my job as the administrator of the Spine Center and running the operations for 6 very well-known spine surgeons and physical therapy and so forth is, as we merge with other disciplines and we grow, which we're doing right now, is to facilitate that growth. I had the privilege of being contacted by the APTA to help comment on the guidelines that were published by American College of Physicians, American Pain Society, and to give that feedback back to the APTA. I've also had the pleasure of working with North American Spine Society, which is a multidisciplinary group. And we're actually in the midst right now of coming up with or issuing new guidelines for physical therapy for patients with cervical spine or neck disorders. As an alum, I wanted to give something back to the physical therapy school, which has given me so much, really beyond my expectations. So one way I thought I could do that was to share some of the funds in my own research fund. And it allows physical therapy students who are collaborating with PT faculty, collaborating with other disciplines within the university, which is a lot about what my career has been about. So whether it's anesthesia or rehab medicine or neurology, what I'd like to see as an outcome from the grant is I'd like to see that much more collaboration between students, faculty, and the other disciplines. Looking towards the future, physical therapists as the portal, as the primary care musculoskeletal provider, and understanding that role, positioning ourselves in that role, and understanding the gravitas of that role and the responsibility that goes along with it is a fascinating place for us to go in the future. My name is Evan Johnson, and I am a Columbia physical therapist.